My name is Luis Miguel Rodriguez, a student at West Texas A&M University. I am providing this video presentation to the faculty at WTAMU in partial fulfillment to obtain my comprehensive master's degree. Today we're going to learn about Alzheimer's and dementia. My goal for y'all to take out of this presentation is to educate y'all on the best practice techniques on Alzheimer's and dementia. We're going to have an overview of what the disease is, the treatments, and local resources that we have in our community to be able to help our patients that suffer from Alzheimer's and dementia. And I say patients, but this not only affects patients, it affects caregivers. Caregivers have to completely change the schedule, their routine of their lives in order to care for these patients. So it's very important that we learn the resources in the local community to help these patients and caregivers. Alzheimer's is the most common form of dementia. Because of the strong presence of Alzheimer's and dementia, along with the frequent behavioral concerns that accompany these diagnoses, these illnesses can be treated as medical illnesses by either medical RNs, LPNs, or behavioral RNs. While there are many types, of dementia, Alzheimer's disease is one type of dementia, which accounts for 60 to 80% of dementia cases. As it is the most common, the statistical information is focused on Alzheimer's disease. Alzheimer's disease is the 6th leading cause of death in the United States. Persons live an average of 4 to 8 years after diagnosis, but can live up to 20 years after it's first diagnosed. Given the long duration of this disease, the strain on caregivers can result in serious decline in their physical, emotional, and financial health. In 2017, 16 million Americans provided an estimated 18.4 billion hours of unpaid care in the form of physical, emotional, and financial support, a contribution to the nation valued at $232.1 billion. While deaths from other major causes continue to decrease, new data from the report shows that deaths from Alzheimer's disease have more than doubled, increasing 123% between 2000 and 2015. For context, the number of deaths from heart disease, the number one killer in America, decreased 11%. Alzheimer's is diagnosed with mental status tests, blood tests, and neurological tests. And as we progress through this presentation, the test that y'all took prior to starting this, we're going to go over these answers. And this is what these little cue cards are there for, just to review the test that I gave y'all before we started. An estimated 5.7 million Americans of all ages are living with Alzheimer's dementia in 2018. By 2025, just 7 years from now, the number of people age 65 and older with Alzheimer's dementia is estimated to reach 7.1 million, an increase of almost 29% from the 5.5 million age 65 and older affected in 2018. What does 7.1 million look like? For reference, the population of Arizona, which includes the cities of Phoenix and Tucson, was 7.172 million in 2018. Every 65 seconds, someone in the U.S. develops Alzheimer's dementia. By mid-century, someone in the U.S. will develop the disease every 33 seconds. It's a scary statistic, guys. Physiologically, many cells in the brain die as Alzheimer's progresses. Okay? Types of dementia. Okay, there are, just a second. let's get back to this. I skipped ahead just a little bit, but we'll go back. Alzheimer's is the 6th leading cause of death in the U.S. and it's the 5th leading cause of death 65 and older. In 2017, the lifetime cost of care for a person living with dementia was $341,840, with 70% of this cost borne by families directly through out-of-pocket costs and the value of unpaid care. Approximately 2/3 of caregivers are women, and 1/3 of dementia caregivers are daughters. So in this room, we have all females. So chances are, if one of your family members has dementia, y'all probably be the one providing the care, statistically speaking. We went over that slide already. Types of dementia. What is dementia? Dementia is not a specific disease. It's a term that describes a group of symptoms. Dementia is the loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities in such extent that it interferes with the person's daily life and activities. Dementia ranges in severity from mildest stage, when it's just beginning to affect the person's functioning, to the most severe stage, when the person must completely depend on others for basic activities of daily living. The most common types of dementia: irreversible and progressive. Alzheimer's disease slowly destroys memory and thinking skills and eventually the ability to carry out the simplest tasks. As this disease progresses, the patient becomes fully dependent on the caregiver on a daily basis. For most people who are first diagnosed with Alzheimer's and dementia, it first appears or presents itself whenever it's age 60 to mid-60s. And it was discovered by Dr. Alois Alzheimer in 1906. How he discovered the disease was that he had a woman who had died of an unusual mental illness. Her symptoms included memory loss, language problems, unpredictable behavior. After she died, though, he examined her brain and found many abnormal clumps, now called amyloid plaques, and tangled bundles of fiber, now called neurofibrillary or tau tangles. These plaques and tangles in the brain are still considered some of the main features of Alzheimer's disease. You won't know, not really a definitive diagnosis of Alzheimer's disease, it's dementia. Can't really diagnose it without examining the brain. And unfortunately, you can't do that until after the patient has passed away. But there's been enough evidence to suggest Alzheimer's disease just with symptoms and the tests and blood tests and the neurological tests that the providers provide whenever they're trying to rule everything out to get to this diagnosis. Age is the strongest risk factor for developing Alzheimer's disease. Another common form of dementia secondary to Alzheimer's disease is the Lewy bodies. Lewy body dementia. Lewy bodies are made of a protein called alpha-synuclein. In the healthy brain, alpha-synuclein plays a number of important roles in the neurons, nerve cells, in the brain, especially at the synapses. The processes causes neurons to work less effectively and eventually die. The activities of certain brain chemicals are also affected. The result is widespread damage to specific brain regions and the decline in abilities affected by those regions. People with dementia with Lewy bodies have a decline in thinking ability that make may look somewhat like Alzheimer's, but over time also develop movement and other distinctive symptoms that suggest dementia with Lewy bodies. So there's a difference. And like I said before, dementia is not one disease. It describes several symptoms. It's coupled in with several symptoms of the different types. Not all patients with Alzheimer's disease develops movement disorders. Oh, excuse me. I'm jumping ahead of myself, guys. Some of the symptoms that dementia with Lewy bodies have are visual hallucinations early in the course of dementia, fluctuations in cognitive ability, attention, and alertness, slowness of movement, tremor, walking, or rigidity, also known as Parkinsonism, REM sleep behavior disorder in which people physically act out their dreams by yelling, flailing, punching, and falling out of bed. More trouble with mental activities such as multitasking and problem solving with the memory early in the course of dementia with Lewy bodies. Occasionally, side effects to medication, dehydration, and poor nutrition may mimic Alzheimer's disease. And guys, just remember these little cue cards are on the test that we gave you earlier before we started the presentation. So just be sure to just look at these cards more specifically or more attentively. Parkinson's disease dementia. Not all patients with Alzheimer's disease develops movement disorders. Not all Parkinson's patients develop dementia. Most Lewy body dementia patients have both symptoms. Parkinson's starts as a movement disorder with symptoms consistent with a diagnosis of Parkinson's disease. Some of the symptoms that they may exhibit is slowed movement, muscle stiffness, tremor, shuffling walk. Cognitive changes in mood and behavior may arise later on. Not all those with Parkinson's disease develop dementia, though many do. Another form of dementia is the frontotemporal dementia, also called Pick's disease. This disease is caused by atrophy, shrinking, drainage to the neurons to the frontal and or temporal lobes to the brain. This disease can affect patients as young as 45. This disease also causes problems with loss of inhibitions, motivations, problems with speech, forgetting the meaning of common words. And that's one of the symptoms that you're going to see in most of these types of dementia. Vascular dementia. Vascular dementia is caused by the lack of blood flow to the brain. This can be related to atherosclerotic disease or a stroke. Signs can appear suddenly or slowing depending on the cause. Confusion or disorientation are common early signs. Later signs are completing tasks with difficulty or concentration. And they also can cause visual problems and hallucinations as well. Other types of dementia, Creutzfeldt-Jakob disease is one, normal pressure hydrocephalus, Huntington's disease, mixed dementia, and Wernicke-Korsakoff syndrome. All these are types of dementia that have been discovered over the years. One of the rarest forms of dementia is the Creutzfeldt-Jakob disease. It progresses very slowly and patients often die within a year of diagnosis. Symptoms are like other forms of dementia. Some patients may experience depression, some experience agitation, confusion, and memory losses is common. Creutzfeldt-Jakob disease affects the boy, causing twitching and muscle stiffness. Normal pressure hydrocephalus is a condition that causes a person to build up an excess fluid in the brain's ventricles. The ventricles are fluid-filled spaces designed to cushion a person's brain and spinal cord. They rely on just the right amount of fluid to work properly. When the fluid builds up excessively, it places extra pressure on the brain. This can cause damage that leads to dementia symptoms. Normal pressure hydrocephalus is one of the types of dementia that can sometimes be cured with surgery. Huntington's disease is a genetic condition that causes dementia. Two types exist: juvenile and adult onset. The juvenile form is rarer and causes symptoms in childhood or adolescence. The adult form typically first causes symptoms in a person when they're in their 30s or 40s. The condition causes a premature breakdown of the brain's nerve cells, which can lead to dementia as well as impaired movement. Symptoms associated with Huntington's disease include impaired movement, such as jerking, difficulty walking, and trouble swallowing, which is a significant symptom. Another form of dementia is the mixed dementia. A patient has more than one type of dementia. A common combination is Alzheimer's and vascular dementia. Wernicke-Korsakoff syndrome, or Wernicke's encephalopathy, is a type of brain disorder that can cause a lack of vitamin B1, leading to bleeding in the lower sections of the brain. At a certain point, the physical symptoms of the untreated disease tend to decrease, and the signs of Korsakoff syndrome start to appear. Korsakoff syndrome is a memory disorder caused by advanced Wernicke's disease. The two conditions are linked and usually grouped together as one condition. It's technically not a form of dementia. However, symptoms are like dementia, or they mimic dementia, and it's also classified with dementia. This syndrome can also result from malnutrition or other chronic infections. However, the most common cause for this particular disease is alcoholism. Next slide. Stages of dementia. Y'all say it with me?
Yes.
Good deal. All right, guys. We're going to start with the stages of dementia. The mild form, cognition, functions rather independently, still able to drive and maintain social life. Lapses in memory, difficulty finding words, misplacing things. Many have difficulty planning, organizing, or concentrating, and accomplishing parts of employment. Last generally 2 to 4 years. The care requirements for this stage of dementia is the patient can still function independently, and at this point the patient probably recognizes that it's losing memory, but patients in the mild stage, they hide it. They hide it very well, and with a detailed interview that the provider can do on a patient in this stage, they can pinpoint it early and begin to treat. Loss of memory, increase in irritability, and restlessness are all symptoms of awesome. Okay, going on to the next stage, it's the middle stage of dementia. Okay, guys? Trouble expressing thoughts. Some of the cognitive symptoms that the patient may present is trouble expressing thoughts and performing daily tasks. They might not remember an address, personal history, or may get confused as to their location. Mild form of disorientation. The caregiver requirements at this stage is they might need some mild assistance with their ADLs, including bathing, grooming, and dressing. It may start off requiring prompts, but will progress into a more hands-on care. And this is the stage where the caregivers begin to start really noticing it, and the patient is unable to hide those symptoms. They're more, the patient presents more, and it requires a caregiver to completely change their schedule and care for the patient almost full time. Like I said earlier in the presentation, this is a major financial burden on the caregivers. And